I would like to bring in Dr. McCance-Katz, who will be sharing more of the on addressing the importance and needs in young Americans. And I think Eric spoke a lot about that. I know my company spends a lot of time with schools and children too. So Dr. McCance-Katz, thank you so much.
Well, thank you. Actions that were taken during the first year of the pandemic in 2020 to address mental health and where we are now. Supporting children's mental health was a major priority pre-pandemic because we knew the need was great. The National Survey on Drug Use and Health told us that in 2019, there were significant increases in major depression in adolescents. Depression can cause serious impairment. Young people not able to be successful in school, not able to fully participate in social activities, and it can increase risk for suicidal thinking and even plans and attempts. Adolescents with major depression also have much higher rates of drug and alcohol use compared to peers without depression, which underscores the significant dangers faced by these youth. With the pandemic came school closures, isolation, boredom, anxiety, stress, and a lack of supports. At the same time as the healthcare system closed to virtually all services except COVID-related care and medical emergencies. For some, it became easier to get drugs and alcohol than to get healthcare. And the pandemic saw increases in mental disorders and overdose deaths. The urgency of the mental health crisis facing our youth is reflected in recent data. CDC recently reported a 31% increase in emergency department visits for mental health crises and a significant increase in suicide attempts in adolescents during the pandemic in 2020, with a nearly 51% increase in suicide attempts in girls relative to 2019 data. CDC also confirmed the poor mental health of adolescents during the pandemic, reporting that 37% of adolescents experienced poor mental health during the first half of 2021. CDC also reported an overall 10% increase in suicide deaths in those aged 10 to 19 during the pandemic, compared to data from the years 2015 through 2019. Added to this was the tragic 94% increase in drug overdose deaths in 14 to 18-year-olds driven by fentanyl exposure. In March of 2020, we quickly moved to shore up the mental health system in anticipation of the effects of the COVID restrictions. In thinking about mental health issues facing our young people then and now, some of the key factors to address include treatment access, social supports, communication, family involvement, and school resources. Telehealth was a critically important move forward in behavioral health care during the pandemic. Telehealth provides a means by which people can access care without having to go in person to a provider's office or to a treatment program. And by adding the flexibility of online visits with a healthcare provider, telehealth reduces stigma and makes it easier for patients to get their mental health needs met. Mental health clinics are now being developed in many schools, and telehealth can be an important resource in these programs. To help facilitate development of these clinics, CMS and SAMHSA developed a guidance in 2019 that gives information on how schools can plan for mental health services that can be Medicaid reimbursable and address the needs of their students. Agreements with behavioral health providers can be put in place that can form the basis of services for children and their families that will be sustainable. Other resources, including the SAMHSA Technology Transfer Centers, which were greatly expanded in the 2 years prior to the pandemic, assisted with the major effort put in place to train behavioral health providers on telehealth services delivery in 2020. Mental health first aid and similar programs that train students and parents, teachers, and school officials on how to recognize and assist someone who is having a mental health crisis is important to early intervention, encouraging us to look out for each other when help is needed. Another important resource is the new 988 number for seeking help in a mental health crisis. There are no-cost online resources such as findtreatment.gov, which can help to locate behavioral health providers. And finally, the rebuilding of the public mental health system continues. Known as the Certified Community Behavioral Health Clinic Program, mental health, Substance abuse and physical health treatment services are offered in one integrated setting for both children and adults. 24/7 crisis intervention services are an important component of this program as well. These resources help to keep people out of emergency departments and in the mental health system that can better meet their needs. So there are a number of resources that now exist and will grow with time in helping to address the mental health crisis, which is so severely affecting our children. These resources can be life-saving, but to be so, people need to be aware of them and aware of how to access services. We've made a list of resources available that can help to provide information people can use to help to find the supports they need. And with that, I'll turn it back over to you, Art.
Well, thank you, Dr. McCance-Katz. I have a quick question. We actually had a question that came in, and it was calling out school nurses, and this is from Kelly Johnson. So school nurses are using telehealth very effectively. I hope the speakers can recognize this goes beyond care providers and physicians. And I can tell you from LTI's perspective, we just did a deal with Ritchie in West Virginia, which is the Ritchie healthcare system, but it's in all the schools. So we put these 5-in-1s, these horoscopes, these healthcare centers in the schools. And would you mind talking a little bit about that, or even Eric, on, because I know Eric brought this up, on some of the specific work that's being done in schools, because that's really that they've been the most impacted, I feel like. I agree, because of COVID.
Yeah, this is an issue that we, as I said earlier, we knew was really important. And in 2018 and 2019, SAMHSA and CMS worked together to develop a guidance that would help the school systems be able to put together programs that could actually bill Medicaid for services. So to have services in the school, they've got to be sustainable, and they're not sustainable unless they get paid for. There are pretty specific kinds of requirements for services to be paid for, and we put this all together in a guidance which will be available after as a result of this webinar, and people can look at that guidance as it might help their schools. But there are already agreements being made with behavioral health providers, with federally qualified health centers that have a psychologist, psychiatrists, other types of behavioral health providers available who can provide those services to children in schools and also to their families. So for a lot of families, they may not want to walk into a mental health center with their child. I mean, unfortunately, there remains stigma around these issues. And so the idea of being able to provide mental health services and also substance use disorder services in a school setting where children are comfortable, where families are comfortable, where you have a school nurse that's available to help to facilitate that visit with the provider. I think this is the way of the future. There are some school systems that are using this now, and we're trying to make that information more widely available so that other school systems can take advantage.
That's great. That's great. I could go on all day on this one area. I know one of the things we did is one of the challenges for school districts is budget for mental health providers. And we went in and we figured out who the main employers were for the area. And then we teed up mental health providers that took that insurance and created a portal for the school district so the parents could be a part of the decision of who is working with their children. It could be part of that mental health and let their insurance pay for it to take the burden off the school district. So there's ways to do it.
Yeah, and I'll also just say that the number of healthcare providers is limited. And so often the distance, this is important for any system, but particularly in rural areas, you can't get the providers into the schools. And so if the child and family previously couldn't get to the provider, you couldn't get the care. Now, with telehealth, you can bring that service right into the school so it's acceptable and appreciated by the providers as well as the children and their families.
Yeah, absolutely. Well, Dr. McCance-Katz, thank you so much for everything you do and for being a part of this call and taking the time to really share this important information as healthcare continues to evolve. So thank you so much with that.